University of Gondar College of Medicine and Health Science and Specialized Hospital. Introduction Academics Departments Academic Programs. University of Gondar Hospital was established in 1920. Primarily for delivery services. The college was established in 1954 as Gondar Public Health and Training Center to train mid-level health professionals in community health nursing, environmental health/sanitation, public health officer. Was established in response to the pressing and enormous health problems that existed in the 1940s and early 50s. Was among the pioneer institutions established by that time. Was the start of the philosophy of team approach and community-based teaching of health professionals. Led by the Ministry of Health until 1960. The college. The college was renamed as Gondar College of Medical Sciences, GCMS, in 1980. The college detached from Addis Ababa University and regained its autonomy in 1992. The subsequent creation of other faculties enabled the college to grow into University College in 2003 and University of Gondar in 2004. One comprehensive and specialized hospital. One institute. 5 schools and 52 departments. More than 97 programs. 5 directorates. More than 4,500 students. More than 4,000 staff members. Currently the college has. The college provides the following student services. Dormitory services. 24 hours by 7 library services. Meal services. Guidance and counseling services. Medical clinic services. Sports and entertainment services. Other services, shop, juice bar, and hair salon services. 46 master's programs, 5 sub-specialty and 15 PhD programs, 13 specialty programs. Educational programs. 18 undergraduate programs. A total of 97 programs, more than 1/3 of the university programs. Undergraduate programs. School of Medicine. Medical Doctorate in Medicine. Medical Doctorate in Dental Medicine. BSc in Anesthesia. BSc in Psychiatry. BSc in Physiotherapy. BSc in Optometry. BSc in Occupational Therapy. School of Medicine. School of Medicine. BSc in Public Health. BSc in Health Informatics. BSc in Environmental and Occupational Health and Safety. BSc in Dietetics. Institute of Public Health. School of Medicine. BSc in General Midwifery. School of Midwifery. School of Nursing. BSc in Pediatric Nursing. BSc in Comprehensive Nursing. BSc in Surgical Nursing. BSc in Emergency and Critical Care Nursing. School of Biomedical and Laboratory. BSc in Medical Laboratory Sciences. School Pharmacy. B-Pharm. Produce competent, compassionate, and committed doctors that would meet the present and future priority health needs of the Ethiopian population and fulfill international standards for medical education. Doctor of Medicine, MD. The criteria may include academic achievement, aptitude test result, personality test, interview result, diversity, sex, disability, and geography, and Absence of major mental and physical disabilities that could affect studying and practicing medicine. This has to be substantiated by experts' opinion. Admission requirements. Preclinical years/pre. Clerkship IN2, 2 years. Clinical years/clerkship IN2, 2.5 years. Internship, 1 year. SIXYEARR. Pre-Med, 1 year. Program structure, composition, and duration. Medical professional involves health advocator, manager, scholars, collaboration, and communicator. In Ethiopia, there is shortage of healthcare workforce is critical for medical doctors. In order to address the severe shortage, the government of Ethiopia has scaled up medical education by expanding number of medical schools and annual student enrollment. Despite the significant stride made to date, the doctor-to-population ratio continues to lag far behind the WHO benchmark of 1 in 1,000, warranting further scale-up of medical training. Job opportunities. Conclusion remark. Generally, medical professional are expert on Department of Public Health Officer. Background. It is found under Institute of Public Health. It is one of the pioneer departments of UOG. Backbone of primary healthcare service of the country for the last half decades. The best ever discipline to be a health researcher. The bridge department having a chance to continue as a clinician or public health professional in future life. Public health is one of the disciplines with a high number of postgraduate programs at higher educational institutions including UOG. Department of Public Health Officer. Job opportunities. Most of the public and private universities in Ethiopia wants to hire public health experts. If you choose to be clinician, the health facilities want to hire public health graduates. Most of the public health graduates are being able to open their own clinics, especially it is common on the rural parts of the country. Most of our alumni are now international researcher. If research is your passion, start here. If you are a public health graduate, you will have a higher likelihood of working at NGOs. If you think leadership is your inclination, boost your skills though studying public health. If you are not yet decided on your real interest whether to be researcher or clinician, don't worry, take time while studying your public health and decide through testing both clinical and public health wings here. The criteria may include academic achievement, personality test, diversity, sex, disability and geography, and absence of major mental and physical disabilities that could affect studying and practicing public health. This has to be substantiated by experts' opinion. Admission requirements. Department of Midwifery. Midwifery program is a 4 years program which mainly focuses on women and their families' sexual and reproductive health. Midwife is a healthcare professional who has successfully completed a midwifery education and acquired the requisite qualifications to be licensed to practice as a midwife and demonstrates competency within their area of practice. Midwives are among the leading healthcare professionals in reducing maternal and neonatal disease and death. Admission requirements. Have a background of natural sciences, meet the criteria set by Ministry of Education, MO, for bachelor degree students. Have good academic performance of first-year common courses, physically and mentally fit, regards to the profession, positive attitude towards the profession. Job opportunities of being a midwife. Midwifery is internationally recognized and respected profession that can allow midwives to work in around the world. Being healthcare provider, manage cases for mothers, women and their newborn. Being educators/counselor of clients and patients. Being health service manager, leader. Researcher. Faculty/instructor. Midwife can also work at higher education institutes, non-governmental organizations, NGOs, and social service agencies. The aim of comprehensive nursing program is to equip nurses to provide high-quality comprehensive nursing care in ethical and professional manner at individuals, family, and community levels at all level of healthcare settings. Manage common MCH, RH, emergency, and mental health problems. Promote and prevent disease at individuals, family and community levels at all level of healthcare settings. Lead and manage nursing care services. Engage in nursing education, research, and advocacy that will improve and enhance nursing profession and services. Department of Comprehensive Nursing. Admissions criteria are: candidates must be a natural science student in secondary school and preparatory classes and fulfill the following criteria. Semester 2 Year 1 students from natural science students meet the set criteria of the Ministry of Education for degree students to join higher learning institution. Physically and mentally fit for nursing service. Admission requirements. Job opportunities. Currently, comprehensive nurses work in all health institutions and their areas of responsibilities vary from client caregivers to management positions, educators in the School of Nursing, and in participating or carrying out some basic research activities. Nurses are the primary source of care and support for clients at the most vulnerable points in their lives. Nearly every person's healthcare experience involves a nurse. Department of Surgical Nursing. The Department of Surgical Nursing is one of the 4 leading departments that formed the current School of Nursing in 2016 from the old Department of Nursing. Requirements to join the department. Meet the set criteria of the Ministry of Education for degree students to join higher learning institution. Physically and mentally fit for nursing service. Preferably, those who choose to enter the profession. Job opportunities. Inpatient clinics, emergency departments, in outpatient surgical units, home health care and ambulatory surgical care. They will be also engaged in research activities, contribute in policy making, advocating, and managing. Department of Pediatrics and Child Health. It is found under School of Nursing. It is an internationally recognized department. Professionals have job opportunities in our country and all over the world. Requirement. To join the program, meet the set criteria of the Ministry of Education for degree students to join higher learning institution. Physically and mentally fit for nursing service. Preferably, those who choose to enter the profession. Emergency and critical care nursing. Emergency organizes as unit in 2014. Followed MO Attention for Emergency Department in 2015. The renovation of emergency room and separate room for different acuity established. BSc in Emergency and Critical Care Nursing in collaboration with Addis Ababa University on January 2011. November 2017 Emergency and Critical Care Nursing recognized as department. July 2017 Generic Emergency and Critical Care Curriculum developed by national level. Then the Department of Emergency and Critical Care Nursing took initiative to expand the MSc training next to Addis Ababa University. Modified National Curriculum in Emergency Medicine and Critical Care Nursing has been developed in 2019 at University of Gondar and the program launched in 2020. Job opportunities. ECCN are health professionals who practice in variety of settings in different health institutions including burn center, trauma unit, surgical emergency departments, dialysis unit, emergency departments, surgical ICU, medical ICU, cardiovascular ICU, CVICU, pre-hospital emergency medical services, ambulance care, disaster management, mass causality management, pediatric emergency units, triage units, Red Cross. In public health emergency responses of governmental and non-governmental organizations, industries, in nursing research centers, and academics. Requirement to join the program. Meet the set criteria of the Ministry of Education for degree students to join a higher learning institution, physically and mentally fit for nursing service, preferably, those who choose to enter the profession. Department of Health Informatics. Health informatics is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services delivery, management and planning. Health informatics incorporates processes, theories, procedures and concepts from computer/information sciences and health sciences. The Department of Health Informatics is opened in 2004 with collaboration of University of Gondar, FMO, and FMA. Job opportunities. At the end of completing the program, the graduate will have the following professional duties: Health Information System Manager, Healthcare Network and Systems Administrator, Healthcare Computer Programmer, Healthcare Database Manager, Administrator, Healthcare Web Developer, Healthcare System Analyst, Health System Researcher, Health Informatics Instructor/Educator, Health System Planner/Officer. Department of Medical Laboratory Sciences. During the time where the college was University College, a Bachelor of Science degree in Medical Laboratory Sciences was started in 2002/2003. This was the start of the training of medical laboratory technicians in the country. Job opportunity. Lecturer in academic institutions. Researcher in research institutes. Health professional in health institutions. Forensic scientist/geneticist. Vaccine developer. Transfusion medicine/blood banking. Can involve in various industries. Requirement to join the department. Applicants with minor physical problems that would not hinder effective training should be considered into the school. However, any student with any visual problem and any problem in manipulation of laboratory equipment using his/her both hands should not be selected to join the school. If the student has a claim on his/her suspected visual impairment, he/she must confirm his/her eye vision with medical evidence. Be physically and mentally healthy and fit to the program. Pharmacy. Department of Clinical Pharmacy. Provide direct patient care that optimizes the use of medication and promotes health. Has experienced staff, has good working clinical environment. Has postgraduate program, Master of Science in Clinical Pharmacy. Job opportunities. Provide direct patient care in hospitals, community pharmacist, hospital pharmacist, primary care pharmacist, researcher academic, pharmaceutical industry clinical trials, government and NGO roles. Requirement. To join the Department of Pharmacy. Requirement 1. Students who have completed Ethiopian high school education and satisfy its entrance qualification assessments. Requirement 2. Students who achieved the highest grade, good academic performance. Must fitted physically and mentally for the DEPT. The Human Nutrition and Dietetics Department aims to build innovative nutritionists and dietitians through the promotion of critical thinking and discovery to alleviate the trained manpower shortage in the field of nutrition and dietetics in Ethiopia, who can assess, plan, implement and intervene on nutritional problems and to equip them with the core body of knowledge on nutritional science and basic research methodology. The program was initially started a postgraduate program in applied human nutrition in 2002 by 4 academic staff members including 1 professor by graduating 9 students, whereas MPH in human nutrition started in 2015. By the 2022 BSc in Dietetics, FIST program in Ethiopia, and PhD in Public Health and Human Nutrition are opened. Department of Dietetics. Admission requirements. Students who have successfully completed the preparatory education and have secured a minimum cut-off point set by the Ministry of Education of Ethiopia in natural sciences are eligible to join the regular undergraduate BSc programs. International applicants with high scores in natural sciences from their foreign country's examination, which is considered to be equivalent to the Ethiopian preparatory education program, are also eligible. The minimum cut-off point is applicable for these students too. Job opportunities. Dietitians are health professionals who practice in a variety of settings including hospitals, healthcare facilities, wellness programs, schools and businesses, government, community agencies, military canteens, sport cafeterias, airline catering services, boarding schools, emergency food service, geriatric centers, prisons, and student cafeterias. Dietetics is the application of knowledge about food and nutrition to help people achieve and maintain health throughout the lifespan. Department of Anesthesia. Anesthesia as a branch of medical practice represents a unique, exciting, specialized, and challenging art and science that deals with perioperative and ICU management of a surgical and/or medical patient. Moreover, it also plays a role in promotional and curative services at the community level. Job opportunities. In comprehensive hospitals in Ethiopia. In general hospitals. Primary hospitals. In the universities. Private sector. Requirement to join the department. Meet the criteria set by the Ministry of Education for degree students. Have a background in natural sciences. Preferably those who choose to enter the profession. Applicant must be physically and mentally fit. Occupational therapy is an internationally recognized health profession that works collaboratively with the people they serve to facilitate their ability to participate in the occupations that give meaning and purpose to their lives. The profession defines occupations as the activities that people do to look after themselves, to enjoy life and to contribute to the social and economic fabric of their communities. In particular, the profession of occupational therapy focuses on improving the daily lives and the community and societal contributions of those who experience disability. It is the first and only department offering occupational therapy BSc programs in Ethiopia. A full approval has been granted to the program by the World Federation of Occupational Therapists for the period 2022 to 2029. Admission requirements. Applicants who meet the GPA requirements set by the Academic Commission of the University of Gondar during their first year of Natural Sciences 1-year preparatory courses. Interested applicants with BSc degree in other health science fields from a known institution, i.e. not diploma holders, will be eligible to study BSc in OT. Applicants should have commitment for inclusion and to work with people who experience disabilities. Duration of the study. The Bachelor of Science in Occupational Therapy degree study at the University of Gondar will be 3 years after the one mandatory year of basic science courses. Therefore, the program is a 4-year program in total. Occupational therapy employment. The demand for OTS in Ethiopia is very high. OTS can work with anyone facing barriers to occupational participation in multiple settings and sectors. This includes but not limited to health centers, primary, general, and specialized hospitals, non-governmental organizations, ministry offices, e.g. for policy development, schools, long-term care centers, e.g. Macedonia, child with special needs centers, e.g. Deborah Foundations. Department of Psychiatry. Mental health problem is the major health issue in the country as well as in the globe. To bring a remedy of this health problem, the University of Gondar opened Department of Psychiatry with undergraduate program in 2009. Since then, the department produced many competent psychiatry professionals. Job opportunities. Despite the increasing of mental health problem worldwide, there is a scarcity of mental health professional in the globe. There is governmental employee, local and international non-governmental organizations for mental health psychosocial support. Top scorers has accounts to hire at University of Gondar and other universities. Ministry of Health and Mental Health Conditions Prevention Strategy Officer. Involved in causality management. Requirement to join the department. Meet the criteria set by the Ministry of Education for degree students. 2. Have a background in natural sciences. 3. Preferably those who choose to enter the profession. 4. Applicant must be physically and mentally fit. Department of Physiotherapy. The PT profession in Ethiopia is relatively new when compared to the history of the profession in other countries. In order to address the severe lack of physiotherapy workforce capacity, a group of Ethiopian health professionals and volunteers from the Netherlands established the Department of Physiotherapy at the University of Gondar in 2002. Today, physiotherapists manage patients with a broad array of health conditions and practice in governmental and non-governmental organizations including hospitals, community-based rehabilitation homes and centers, private and public outpatient clinics and refugee camps. Requirement to join the department. Meet the criteria set by the Ministry of Education for degree students. Have a background in natural sciences. Preferably those who choose to enter the profession. Applicant must be physically and mentally fit. Department of Dental Medicine. Ethiopia, one of developing countries in the world, has barely any access to dental treatment. So Ethiopia is one of dental professionals' highly demanding country. A dental graduate has many job opportunities like in clinical and academic services, research and innovations as this field of study is rapidly growing in digital technologies and innovations. Admission requirement. Academic achievement. Aptitude test result. Personality test. Interview result. Absence of major mental and physical disabilities. Time: Department of Optometry was launched in 2006 with the support of Orbis International Ethiopia, that acting on the 3 pillars of the University of Gondar. Job opportunities. Optometry is very demanded both from public, private sectors, and NGOs. The global eye care workforce standard set for developing countries is 1 optometry to 50,000 people. Hence, the market demands a minimum of 2,500 optometrists in Ethiopia. Presently, only 30% of the target is achieved. Requirement to join the department. Good visual function in both eyes. Department of Optometry. Department of Environmental Health. The program or discipline is a multidisciplinary aimed on designing environmental health policy, legislation, standards, and guidelines related to environmental health disciplines. Job opportunities. 1. Environmental Health Officer in federal and regional health offices. 2. Health and safety officers in different organizations. 3. Expert in outbreak investigation. 4. Inspector for different health-related institution. 5. Disaster emergency management. 6. Quarantine officer. 7. Educator in higher education. 8. Researcher in different research institutions. 9. Consultant in their expert. 10. Project officer in NGOs. Placement system. Placement system address. 10.139.8.110. About the system. Use the video tutorial. For technical support. Abeba Ailmu. 091-877-7891. Yosef Berhanu. 091-878-9555. We are always devoted for excellence.